Hey everybody, I'm Selena Esakau, the Garden and Wellness Coordinator here at Healthy Start.
And I'm Tanya Lopez, a nurse midwife with Healthy Start. And today we're going to talk about some positions and stretches you can do to alleviate some of the common pains that you may have in pregnancy. A lot of times you'll get pains down in your groin, around the bottom part of your belly, and we call those round ligament pains. They're very common in pregnancy, but they can cause a lot of pain. So Selena's going to show you some positions you can do to alleviate some of those symptoms. The first one you can do is called the piriformis stretch. So the best way to do this exercise is to sit in a chair. Then what you do is you put your ankle up on your opposite knee. Now when you do this, you might actually feel this more in your back than in your groin, but the reason that happens is because your pelvis is kind of getting pulled in one direction or the other. So you sit up straight, as Selena's doing, after you have this position, and you lean forward into that stretch. And you'll feel it a lot in your back, down in your hip, maybe even a little bit down into the back of your leg. Try to do it for about 30 seconds on each side, 3, 4, 5 times a day, however much you can tolerate it. And this will actually align your pelvis. Then you can change sides. This will actually align your pelvis so that you're not having so much pulling to one side or the other. And this actually helps with that pain down in those sharp pains down in your lower abdomen.
Feels really good, yeah.
So if for some reason you just can't get that ankle up on that knee, because when you're pregnant and your belly's sticking out, sometimes it's a little bit hard, you can put it a little bit further down on your shin. Can you show us some modifications for that? Sometimes it's a little bit hard to get that ankle all the way up on the knee, and if you can't make it, then you could do some modifications where you bring your ankle a little bit lower on your leg. Another stretch that you can do, and some of the reason that your pelvis gets tilted and you have those lower back pains and also those ligament pains that we were talking about, is because your hamstrings get really, really tight, and sometimes we don't like to stretch those because we're afraid we're going to get leg cramps. Selena's going to show you a hamstring stretch that you can do in your kitchen, just up on the ledge of your cabinet, or you could put your foot up on a chair. Just a good way to stretch out those hamstrings. And see how she's got her leg up on the foot of that chair? Then you just bend forward just to get a good stretch in your hamstrings, all the way back up the back of your leg, all the way up to your glutes. And this can also be the source of pain that kind of shoots down one leg. We call it sciatic pain, and this will help with that as well. You can do that on both sides 2 or 3 times a day. Also do that before you go to bed at night, and that might help to prevent some leg cramps from happening. Okay, the last stretch we're going to show you involves you getting down on the floor on your hands and knees. And what this does, if you think about it, this is going to make your baby get in a bit better position. So it's not laying on a nerve that's causing you to have back pain or lower abdominal pain. And so this is just called a cat-cow in yoga, but you can also consider it a pelvic tilt. So if you just get on your hands and knees and do a few of these where you're just kind of rounding your back, you can take a nice deep breath in and see how she's rounding her back, and then you just let your belly kind of drop. Just let your baby kind of shift into a different position. Another breath, round out your back just like if you were a cat and you were trying to scare somebody away. And then again, you just let your belly drop, and that's going to help get your baby. You can wiggle your hips a little bit here in this position, and that will help also convince your baby to get in a new position so that it's not causing you so much discomfort. That's awesome.
If you'd like any more information about prenatal exercises and movement and yoga exercises, please hit us up. Our email and contact information is in the description. Namaste.